Hello, my name is Dr. Richard M. Thomas, and I would like to thank you for coming to the New Life Anti-Aging Clinic website. Today, I will be presenting a short educational talk entitled How to Stop the Pain of Peripheral Neuropathy. Neuropathy can be a complicated and serious condition. I will be discussing what peripheral neuropathy is, what some of the causes are, what some of the complicating factors are, what laboratory tests should be done, the examination, and ways to treat neuropathy. What is neuropathy? Well, neuropathy is defined as a disturbance in the function of a nerve or a group of nerves. In neuropathy, nerves have been damaged in some way. Nerves also have an insulating sheath around them, much like electrical wires in your home. This insulation is called a myelin sheath and can also be damaged in neuropathy cases. Damage to nerves and myelin sheath causes an abnormal nerve signal to be sent from areas like the arms and the legs to the spinal cord and up to the brain. The pain of neuropathy is the result of abnormal processing of nerve impulses in the brain. Some common symptoms of neuropathy are tingling and numbness, medically referred to as paresthesias, burning sensations, itching and crawling types of pain, medically referred to as dysesthesias, and just outright pain. The outright pain of neuropathy is usually severe and can be cutting pain, crushing pain, shooting type pain, stabbing pain, burning pain, or a gnawing type pain. Many neuropathy sufferers experience a combination of these abnormal sensations and pains. 7 warning signs of peripheral neuropathy are numbness, burning feet, cramping, sharp electrical pain, pain when walking, difficulty sleeping from leg discomfort, and prickling and tingling sensations. Neuropathy can also affect the other nerves in your body. If it affects motor type nerves, there can be a loss of muscle strength or muscle atrophy. The symptoms that a person suffers from depends upon which nerves and which types of nerves are affected. Sensory changes can occur when the sensory nerve fibers are affected. Some common sensory symptoms are burning sensations, nerve pain, tingling, numbness, and the inability to determine joint position, which results in incoordination. These neuropathies often begin in the feet and progress to other body areas. When the nerve supplying muscles are affected, muscle control can be interfered with, causing weakness, a loss of muscle bulk, and a loss of dexterity. Sometimes muscle cramps are an early sign of motor nerve involvement. The autonomic nerves give supply to your internal organs and glands. When these nerves are affected, there can be a wide range of problems like abdominal bloating, blurred vision, constipation, decreased ability to sweat, diarrhea, difficulty in beginning to urinate, urinary hesitancy, urinary incontinence, or a feeling of incomplete bladder emptying, dizziness, vertigo, and much, much more. As you can see, the symptoms of neuropathy can be quite complex, severe, and can affect many different areas of your body. There are many causes of neuropathy. In order for neuropathy to be properly treated, a complete evaluation must be done. When you understand that neuropathies can begin in one area of your body and spread to other areas of your body, you can see just how important a proper evaluation and treatment are. Some major causes of neuropathy include alcohol abuse, which damages nerves, autoimmune disease, which causes damage or destruction of the insulating myelin sheath of nerves, hormone imbalances, which often complicate neuropathies, low thyroid dysfunction, trauma or injury, and chronic irritation or inflammation of nerves. Physical injury or trauma can also include such things as arthritis, spinal stenosis and disc problems. Poor diet can also cause or worsen neuropathy. 2 especially important causes of neuropathy are diabetes and the statin drugs that are used to treat high cholesterol levels. We're going to talk about these in more detail because they are so important. The statin drugs can and do cause neuropathy. How this occurs is rather complicated, but in the end, statins inhibit or slow down energy production in nerve cells. When the nerve's energy production falls to a certain level, the nerve cell will degenerate or die, resulting in a neuropathy. This is especially true in people who are older. Older people produce less cellular energy to begin with. And who do you think takes more statin drugs, younger or older people? That's right, older people. Older people have less cellular energy reserve, and if statin drugs lower this nerve cell energy production further, guess what can happen? Nerve cells begin to deteriorate or die. The result, neuropathy. As this process of nerve cell damage continues, the frequency of firing of these damaged neurons will decrease. This reduced nerve cell firing is perceived by the brain as numbness, tingling, pain, etc., depending upon the exact type or types of nerve fibers that are affected. To give you an idea of how serious the statin drug side effects are, we looked at some current research which says that statin drugs increase the risk of peripheral neuropathy by 1,600%. Statin drugs can be a real issue in the neuropathy patient. Another common cause or complicating factor in neuropathy is diabetes. Blood sugar dysregulation can damage nerves. About 50% of the people with blood sugar problems will develop neuropathy. In diabetic cases, autoimmune dysfunction will often complicate the diabetic neuropathy situation even further. Since we are talking about nerves and their function in the case of neuropathies, let's take a look at how nerves work and how the brain perceives abnormal nerve signals. Nerve cells transmit their signals to each other with neurotransmitters. Nerve cells use neurotransmitters to send nerve signals to all of your body tissues, organs, and glands. This is also how nerve signals get to the brain and how nerve signals travel within the brain. There are many neurotransmitters in your body. Some of the most common, especially in the central nervous system, are dopamine, GABA, serotonin, and acetylcholine. As we have seen, nerves connect to and control every area of your body. When there is a change in the frequency of firing of the nerve signaling pathways due to some type of damage or an alteration of this nerve signaling, a wide variety of symptoms can arise. It is critical to evaluate and, if necessary, treat major body systems in neuropathy cases. This includes such things as anemia, blood sugar dysregulation, gastrointestinal and liver issues, fatty acid metabolism, immune system and autoimmune attacks, adrenal gland function, hormone imbalances, thyroid dysfunction, cellular energy production, and neurotransmitter imbalances. Neuropathy is a complex, serious condition, and there are many issues that can affect proper nerve signaling and the transmission of nerve impulses. This is an example of what I believe is necessary to evaluate a neuropathy case. We have discussed many factors which can cause or aggravate neuropathy. Among them are adrenal function and cortisol, blood sugar, hormones, cellular energy production, and a misfiring of the nerve cells up to and including the brainstem and the brain. Good neuropathy treatment should involve a proper evaluation in order to provide the necessary treatment for each of these problem areas, while utilizing a treat the whole person or holistic approach. Exactly what is a neuropathy with autoimmune involvement? It is an autoimmune disorder. Your own immune system is attacking your body, causing the neuropathy. In the majority of neuropathies, autoimmune involvement is at least one part of the cause or the aggravation of the neuropathy. Testing must be done to check your immune system. If there is an autoimmune involvement, it must be properly handled or you will never get completely better. So, if you have a neuropathy, what should you do? First, there are several questions that you should be asking yourself. 1, is my condition either not getting better or worsening? 2, do I have to keep increasing my pain medicine? 3, am I becoming dependent upon pain medications? 4, would I like to get to the cause of my neuropathy? And 5, would I like to improve my condition and quality of life? If you answered yes to any of these questions, then you need a comprehensive evaluation to help identify the root cause of your neuropathy. What is a comprehensive evaluation? It includes physical examination, neurological examination, and lab tests to check for such things as immune system dysfunction, gluten sensitivity or intolerances, food sensitivity or intolerance, thyroid dysfunction, thyroid antibodies, adrenal function, anemias, hormone balance, comprehensive metabolic panels, neurotransmitter assessments, and antibodies to nerves or myelin sheaths of nerves. Following this, and based upon findings, a patient-specific treatment plan is developed for that person. Now, what kind of treatment might be done if you have a neuropathy? The answer is comprehensive treatment. This can include such things as retraining the frequency of firing in the neural pathways into the brain or brain-based therapy. Remember, neuropathy damage causes abnormal conduction of nerve impulses from the extremity to the spinal cord to the brain. 2. Treat metabolic dysfunctions. 3. Treat any immune system dysfunctions. 4. Balance hormones. 5. Balance neurotransmitters. 6. Stimulate new nerve cell growth. 7. Laser treatments. 8. Infrared therapy. And 9. Rife nerve activation. What makes us different in the approach to your neuropathy? We do complex metabolic and neurologic testing. We seek the root cause of your neuropathy. We do not use the simple Band-Aid approach of only treating symptoms. We check major body systems. We understand the importance of immune system, hormones, the neurological system, the endocrine system, and neurotransmitters in returning your body to healthy function. We devise patient-specific treatment plans based upon your test results. We do not use a cookie-cutter approach, and our promise to you that we will leave no stone unturned to find the cause of your illness. Thank you for listening to this educational presentation on neuropathy.